Now, in light of the seemingly worsening situation in the health sector, we are now joined via Zoom by Dr. Christopher Tufton, the Health Minister. He'll give us some answers and an update. Dr. Tufton, thanks for joining us.
Thank you.
All right, first of all, another standoff with nurses and arguably the worst possible time. What have you heard is the cause of the sickout and what is being done to fix it?
Well, yesterday I met with nearly 300 nurses on Zoom, including the executive, the NAJ, and they had several issues that were raised: working condition, the stresses associated with the overcrowding, wages, salary issues, and a number of other issues. We discussed them. I committed to meeting back with them in 2 to 3 weeks. And then, of course, we had this issue this morning where some 28% of nurses called in sick or was just absent. I since had a meeting this evening with the NAJ's executive. We went over some of those issues and I committed to following up with them on some of the concerns. And I'm hoping that based on that discussion tomorrow, we will see more persons coming out.
We see a statement here from the NAJ. One of the issues are statements in the print media. Can you speak a bit on that?
Which one is that? Sorry.
The issues they pointed out: working conditions, remuneration, and statements in the print media. Was that raised with you?
Right, yes. The statement that was attributed to the Prime Minister was raised as a statement that seemed to have caused some upset. I reassured them that there needed to be clarity because the Prime Minister really in his statement did not mention nurses or doctors. I've listened back to the tape. I was there. He spoke to a process of triaging for attention of persons who need help in the healthcare system and the doctor on duty making the call. The truth is that the Prime Minister and by extension the government is very sympathetic to the conditions and the challenges of our nurses and doctors. And as part of the key frontline response in this instance to COVID, we are committed to being prompt and efficient to the extent that those frontline workers or nurses require attention. And that is a commitment that has always been in place. And we are committed to that. So I really tried to reassure them that there was no offense intended and that the statement was misinterpreted.
Okay, we have hospitals being overwhelmed with cases. Why aren't we seeing the field hospital plan being rolled out that we spoke about last year and earlier this year?
Well, we do have 3 field hospitals currently in operation at Spanish Town, Falmouth, and St. Joseph's, and those are functioning. Spanish Town had some issues we've sorted out. The other 3 are slated for Sablamar, Mandeville, and Maypen. The technical specifications are in place. The base are being prepared, I think more advanced in some areas than others. But there are plans to put those additional capacities in place to address some of the bed concerns. And of course, in terms of the personnel concerns, you would have seen us advertise for more nurses and doctors, including retired nurses and doctors.
Okay, good. That's what I was going to ask you next. What has been the response so far?
So far, I'm encouraged. When I checked this evening as to the response, we had a couple, I think about nearly 200 expressions of interest. Now, those would have to be vetted to ensure that they are nurses and doctors, and then they will be called in. So we have dissected or segmented those lists to equate them to the regional authorities that they fall in, and the regional authorities will then vet them, call them in, and as soon as we determine their suitability, they will be deployed to provide assistance to our nurses and doctors, particularly in the vaccination and the COVID response.
Okay, good. As it relates to vaccination, the opening of the Pfizer vaccination to everyone, some persons say it's hampering the drive for students and reopening face-to-face school. What do you say to that? And give us an update on the latest vaccination numbers.
Well, we are committed to trying to get face-to-face classes back up. I think it's doing a disservice to our young people, traumatic to them not to have classes for over a year. Them being vaccinated clearly gives them the protection, they and the staff and workers within that environment. Over the last 4-day blitz, we did about 26,000 between the ages of 12 and 18. We did about 57,000 overall. It did pick up on the last day where we did a record number of 21,000 in that single day. We're planning again for this weekend coming, and also with the expansion that we anticipate utilizing additional staff, we are hoping that we will see not just students, but the general population taking up the vaccines. We do have the Johnson & Johnson, which will come into the system, the single dose. So I'm hoping that the issue now is around mobilization and delivering the vaccines. And I'm encouraged by what I have seen over the last day or so.
Okay, good. Thank you very much. That's all the time we have for this evening. Dr. Tufton, Health Minister, responding to some of the issues we've seen in the health sector today.